Independent Community Pharmacy Association has raised the alarm over the use of dexamethasone to prevent COVID-19. The drug has been hailed as a breakthrough in the treatment of severely ill COVID-19 patients being treated in ICU, but the association is warning against abuse of the drug. Jackie Maimin is the CEO of the Independent Community Pharmacy Association, and she joins us now via our Skype line in Cape Town. Jackie, thanks very much for your time this morning. I think we're all really looking for some good news in the fight against COVID-19, and that really what dexamethasone was. You know, when the minister announced it, I think it was last week or the week before, that there was this corticosteroid that offered some relief for patients who were on ventilators and who were in need of oxygen. But now you're cautioning against dexamethasone. Tell us why.
Okay, so no, I think it is really good news. You know, we found something that, although it's not a treatment for COVID, it treats that huge inflammatory response that people have when they end up in ICU. So patients on oxygen and patients that have been ventilated. I mean, to be able to save 1 in 3 people is absolutely amazing. So I think we mustn't take away from the really good news. The reason we're concerned is that we noted that suddenly dexamethasone was available online. So what we wanted to warn people out there is that it is not a preventative. Please don't go and start acquiring dexamethasone and taking it as a preventative. In fact, it can do the exact opposite if you take it while you are well, because what it does is it lowers one's immune response. So it'll make you more susceptible to contracting COVID-19 if you use it inappropriately.
Yeah. Some important advice there, Jackie, just because, you know, we talk about the body's inflammatory response, and eventually what it does is that it overreacts. And so that's where dexamethasone comes in and offers some relief.
Absolutely. So you would have heard Prof. Karim. I mean, he's become a celebrity on our media. Prof. Karim talking about the cytokine storm. So what happens is when the virus really starts to overwhelm the body, it's almost like panic stations for our immune system, and we start generating this massive response to the virus. But unfortunately, the inflammatory response, which would normally help us, actually overwhelms our lungs, and we start battling to breathe. Our lungs fill up with mucus, and we start getting secondary infections, pneumonias. And so what the dexamethasone does is it's a potent corticosteroid, and it dampens down that immune response and saves lives. And as I say, that really is good news. But what I don't want people to do is to start self-medicating with dexamethasone. That will be a disaster.
So what happens to me if I start self-medicating with dexamethasone as someone who is healthy, who is not COVID positive?
Okay, so there's a few things here. And our concern is that it seems to be available online. So firstly, don't ever buy medicines from a source that you cannot identify. Medicines may only be sold by healthcare professionals, so it needs to be a pharmacy in South Africa registered with the South African Pharmacy Council. So that's the first thing. Make sure it's not a counterfeit medicine, and that some of the medicines available online, you don't even know what is in there. You may as well buy it on the corner of the street. The other thing is that if you take it while you're healthy, firstly, there is no benefit. So all you do is you get the risks, the side effects, okay? And the side effects are, it lowers your immune response. So it makes you more susceptible to COVID-19 in a time where we are doing everything to boost our immune systems, to prevent us becoming infected. Secondly, it's the side effects. So dexamethasone is a potent corticosteroid. It's a Schedule 4 medicine, which means that only a doctor may prescribe it and a pharmacist may dispense it. So your patient needs to be fully evaluated. Certain people can have huge allergic reactions to it, even anaphylaxis. You can get stomach ulcers. Diabetics, it can be disastrous because it affects your blood sugar levels. It can cause osteoporosis and long-term hypertension, edema, insomnia. I mean, I can go on. The list of side effects is long.
I mean, it tells a story, doesn't it, Jackie, that South Africans, and I suppose it's a phenomenon perhaps we're seeing in other parts of the world as well, but there is such a fear around COVID-19 that people are making irresponsible decisions like self-medicating.
Absolutely. And look, I think it is really scary. I mean, this is the first time in 100 years that we've had something as severe as this. It certainly never happened in my lifetime. Who would have known this time last year that we would be doing what we're doing now? I mean, I'm working from home and speaking to you via Zoom. I'd never even heard of Zoom until the beginning of this year. So our entire lives, our normal has changed, and there's no doubt about that. And there is fear. And in certain circumstances, it is well-placed fear. Because, you know, I think in the elderly and people with comorbidities, you need to be very careful. You do not want to end up in hospital. But there are so many things we can do to stem that. Yeah. And as I say, one of the things you shouldn't do is self-medicate. Please pick up the phone, speak to your pharmacist, speak to your doctor. There's telemedicine. There are so many wonderful systems available. Doctors on Call, which is a free service. So there's no need to self-medicate. We're there to help you.
Yeah. Jackie, I want to just ask you a question about dexamethasone. You know, as you have described, you know, it's been hailed as really a positive step in the right direction, particularly to help save lives, people who are on ventilators, people who are receiving oxygen. Are we able as yet to measure, you know, how effective it has been since it was discovered that it is quite effective for those particular COVID-19 patients?
Okay, so here in South Africa, probably the answer is no, because it's only just recently been approved onto their essential medicines list for ICU patients. But from the study in the UK, they had really amazing results. I must say that that still needs to be reviewed, and we would need more research. But the initial results coming out of the University of Oxford are very encouraging. I think it was 35% recovery rate for people that have been ventilated is absolutely amazing. And that's why I say it is good news. And dexamethasone is a drug that has been around for many, many years. It's something we know really well. And the even better news is that it is manufactured in South Africa. And so it's very unlikely we're going to run out of it.
Yeah, so plenty of good news there. Thanks very much for weighing in on this discussion. Jackie Maimin is the CEO of the Independent Community Pharmacy Association. And yes, dexamethasone is good news in our fight against COVID-19. But what they are warning against is self-medicating, using dexamethasone as a preventative, which it is not. It is only for people who are COVID positive, who are receiving oxygen, who are in ICU on a ventilator. And certainly some good advice there as well. Do not ever buy medicines online if you cannot vouch for exactly which organization you are buying from.